and welcome to Health Matters on Channels Television. It's nice to have you join us. I am Mary Alale Yusuf. Every year, outbreaks of meningitis affect over 400 million people in about 26 countries of what is termed the extended African meningitis belt, which extends from Senegal in the west to Ethiopia in the Horn of Africa. Cases in the belt have been on the decline since 2010, with about 24,000 cases in that year and half that number in 2014. In Nigeria's most recent outbreak, the worst since 2009, over 2,000 suspected cases have been identified and more than 300 deaths recorded, according to the Nigeria Center for Disease Control. Included, however, in the country's extended program on immunization is a vaccine which targets meningitis. With me on the show today is Dr. Ngozi Ulonnam of the Department of Pediatric Neurology in the Lagos University Teaching Hospital, Idiaraba. You're welcome to the show.
Thanks for having me here.
Let's first find out what really causes meningitis.
Okay. Meningitis is an inflammation of the coverings of the brain. The brain and spinal cord are covered by membranes, protective membranes called meninges. So meningitis is inflammation of the fluids that surrounds these membranes, and that is meningitis. So it can be caused by several things, but most commonly bacteria and viruses. And in children, we have some bacteria that affect the children more. We have three in particular: the Haemophilus influenza B, organism, the Streptococcus pneumonia, and the Neisseria meningitidis in the older children.
Okay, so are all these taken care of in the vaccine that babies take?
Yes. For example, we have the pentavalent vaccine that the children receive at 6 weeks, 10 weeks, and 14 weeks. Pentavalent vaccine is made up of the diphtheria, pertussis, tetanus, and Haemophilus influenza B covering for that organism. And then it's free, and it's given at that schedule. 6 weeks, 10 weeks, 14 weeks. At 6 weeks, 10 weeks, and 14 weeks, and it's free.
Is this in the DPT?
Yes, DPT was just 3, but they added hepatitis B and Haemophilus influenza B to make it a pentavalent vaccine.
Okay, that's why it's called pentavalent.
Yes, 5 now.
So if somebody takes this vaccine, shouldn't the person be protected from meningitis maybe all his or her life?
No, not for all his or her life, but for that critical period. For the under 5s, they're protected. And that's for just one. We still have the pneumococcal vaccine that protects us against the Streptococcus pneumonia. And it's also given within the same schedule, 6 weeks, 10 weeks, 14 weeks. And it's also free.
And all available. These are the bacteria-caused ones?
Exactly. Which
not
is the
other ones which may be caused by viral infections or anything?
Exactly. But the most common ones are the bacterial ones. The most common and the ones that give us a lot of problem are the bacterial-caused ones. And vaccines are available to prevent them.
Okay, so when people do come down with meningitis, because I've learned that people have come down with meningitis, let's not even talk about the north yet. Is it because they missed their vaccine or because the causative agents just got through the protection?
Okay. So when people come down with meningitis, for example, here, some people miss their vaccines, that's true, and then they are at greater risk of having this infection. We know that it's transmitted via respiratory droplets. We have individuals who have these organisms in their nasopharynx. They are carriers of this. They don't have it, they don't manifest the
So
disease.
They just walk about with the causative agent?
Yes, and they are not manifesting any form of sickness. But then when we have person coughing, sneezing, and then maybe a child gets in contact with these respiratory secretions whose immunity is not as strong as it should be, that child is at risk of having this meningitis.
Why would a child's immunity not be as strong as it should be?
Okay. You know that children have less, their immune system is not as developed as the adults. That's number one. And number two, if you have a child that is not being exclusively breastfed, person's immunity is already at risk. If you have a child that is malnourished, that child's immunity is already at risk. So when they're exposed to these organisms, there's an increased chance of them coming down with meningitis, especially if they're not vaccinated.
But if they're vaccinated, it could still happen?
It's not likely. It's not likely. If they're vaccinated, they're protected. But if they have other risk factors, like we said, malnutrition, lack of exclusive breastfeeding, the chances are worse.
Are these children supposed to get another vaccine later on in life for this same meningitis?
No, from 4 years, the immune system develops, and then their body protects them against this. That's why the vaccination schedule doesn't extend beyond that period, beyond 2 years, 3 years, doesn't extend beyond that. But when we talk about the third type, the one caused by Neisseria meningitidis, that one occurs in older children, and then the vaccine is given from 1 year all through adulthood. But it's more important for those in the north, in the meningitis belt.
So this is the problem we are dealing with in the north, this particular strain.
Exactly, Neisseria meningitidis is what we are dealing with in the north. That's the one that causes the epidemics. And that's the one, in the north, they also have the vaccination programs covering them against these organisms.
This particular Neisseria meningitidis?
Yes, but we know there are different serotypes. Serotype A, B, C, Y, W.
There's X, there's W?
Yes, X, W. Yes, so there's a different strain right now. Usually the vaccines cover for A, but said serotype C is what we have on ground right now. But the treatment is basically the same for the two serotypes.
Okay, so in the north now, it's people who are slightly older.
Yes.
5, maybe to 14.
Exactly.
That are coming down with meningitis.
Exactly.
But is it because this is a different serotype? We're not used to this serotype C. It happened last year. It happened in 2013. Doesn't the vaccine at least offer a bit of protection for them, even though it's a different serotype? Okay,
for example, that is the meningitis belt, and it's more prone to epidemics because of the weather, the dusty climate, the hot climates. And when we have overcrowding, then we have malnutrition, socioeconomic issues, poverty, the risk of transmission is going to be more. And then not everybody has had the vaccines. And the vaccines, like we said, were mainly for serotype A, and we have serotype C coming in now. So the chances are more right now. But vaccines for serotype C are also being made available. Yes.
I was going to ask you, but you answered that question right off that.
Yes.
I had the impression that meningitis is somehow, connected to heat, because it's like where hot places it happens. Does that encourage the bacterium to grow?
Okay, like in a hot place, like in the north, the weather is usually very hot, and we have the overcrowding. That's another increased place. So the carriage level will be more. The carriage level,
the spread.
Yes, the spread will be worse, especially when there's now overcrowding.
With dust too.
Exactly, with dust.
Okay, can you tell us some of the symptoms of meningitis?
Okay, there are some symptoms that are not non-specific. Person will come down with fever, headache, abdominal discomfort. The child may stop eating, be vomiting. Then the other signs that will make us think more of meningitis, the photophobia, that's increased sensitivity to light. Exactly. Then the neck pain. For an older child, to say there's pain on trying to bend the neck. Okay, that's
just to be clear, this neck pain or neck stiffness, isn't it what happens in tetanus?
Oh yes, but in tetanus it's not just the neck. They have abdominal wall rigidity. The abdomen is also very rigid. It's not specific for the neck. It's most of the muscles of the body.
Okay, is there any physical symptom that is distinctive of meningitis that makes it stand out as meningitis?
Okay, that would be physical signs that the doctor would demonstrate. Those are the signs of meningeal irritation. That one, the doctor will demonstrate that. It's not what somebody will say and say he has this physical...
or she still needs to be diagnosed by a doctor.
Exactly.
Which makes it really dangerous, because some of these symptoms could be...
malaria.
They could just guess it's anything.
Exactly. And start taking self-medications and present late.
And, okay, so if somebody presents in time, what do they do for somebody who already has meningitis?
Okay, when they come in, the first thing we do is to take a history. We want to know when did this symptom start. Then we want to also know if it's here in the south, have you been to the north, have you been in contact with someone that's had meningitis. And then the diagnostic test is taking water from the back. That's the lumbar puncture. We want to look at the fluid that surrounds the brain and then examine it. There are several things in it that will make us think that this is actually meningitis.
Just to digress a
Yes,
bit,
please.
you said meningitis is actually the inflammation of the
Coverings of the
brain and the spinal cord.
Yes.
So, can they get inflamed without being infected?
Okay, then
Like maybe there's head trauma or something like that.
okay, yes, in head trauma, yes, there is now a direct connection between the external and the brain. So there's an easy route for infection to come in. Then also in conditions like what we call orbital cellulitis, infection of the eyes, that's a direct transmission. You can get direct transmission to the brain. If you have chronic sinusitis, you could get we call them contiguous areas.
So which means almost anything can cause it.
Yes, if we have infections.
Sinusitis.
Yes, sinusitis can cause meningitis, orbital cellulitis. If you have infection of the bone surrounding the face, you have an increased risk of having meningitis.
Is there ever any meningitis that is not caused by an organism?
Oh, sure. We have meningitis caused by drugs. We have meningitis caused by cancers, but they are not as common as the ones,
caused by bacteria,
exactly.
especially. But if you were to have, that kind of meningitis, and you did a lumbar puncture, you wouldn't come up with any causative organism. In which case, what would you use as your distinguishing feature?
Okay, from the history, for example, if the patient comes to you, those kind of people may not have the typical features, the neck stiffness, the fever. There could have been a history of drug ingestion. There could have been a history of maybe the patient has other clinical conditions, patient that has cancer. But there'll be something else. It won't give you the typical history of a child with meningitis. And then when you examine this patient, you may not find the clinical features suggestive of meningitis. It's different. And then the CSF picture too. Okay. You will not have the organisms in the cerebrospinal fluid because it's not infective in origin.
Okay, there's one other thing, we were taught that there's this barrier between the brain and the rest of the body.
Yes,
the blood-brain barrier. Yes. And that almost nothing can cross it. So what's happening here?
Okay, the blood-brain barrier, it's not like a physical membrane, just a cell layer that actually protects the brain from the organisms in the blood. But these organisms, they are special in that they have protective mechanisms that will defend them against the ability of the body to fight them, and they can easily cross. They have predilection for the brain. So they have special features in them that will help them cross that blood-brain barrier and get to the brain.
Okay, if somebody has meningitis, is infected with meningitis, how long does the person have to react? The reason why I'm asking this is, first of all, the person will be thinking, okay, I have a fever, a headache, and takes painkillers and something to bring down the fever. Maybe 2 days pass. And then, okay, it's not that. Maybe let me consult my doctor, or let me wait a day more. How long does it take, for it to really be, you must go to the doctor now?
Okay. We always say that early detection would improve the chances of complete healing, complete treatment, proper care. So it depends, actually. There are some that are present in an acute manner and within a few days it's life-threatening. There are others, like the viral one, it has a very slow course, bacterial one too, but within 2-3 days, symptoms are very, very evident. But if you have features, like we said, the fever, the headache, the nausea, the vomiting, any pain in the neck, photophobia, you should present to a health facility to be evaluated.
Immediately?
Immediately, yes. There's no room for self-medication.
Okay, you have mentioned that the method by which it's caught is droplets.
Respiratory droplets.
Respiratory droplets, yes. No other way. When we come back from the break, we'll be taking up from there, but let's go on a short break now.
Yes.
We're going on a short break. Please stay with us. We'll be back in a minute.